right, we're back live tonight here on In Focus, and thanks for staying on. A preliminary investigation by the Northwest Health Department has blamed the management of the Mahikeng Provincial Hospital for a lack of incubators. This after babies were pictured in cardboard boxes at the facility. Let's unpack this now with Wits School of Public Health Professor Laetitia Rispel, as well as the National Health Department's Dr. Manala Makua. We appreciate you both for coming on. Good evening, and thank you very much for your time tonight.
Good evening, Thabo, and thank you very much, and good evening to the viewers.
Let me begin with you then, Prof. There obviously is an environment in which health practitioners are operating in that is resulting in these events happening. If it's not the elderly being chained to a chair, it's mothers giving birth on the floor, or it's babies being put in cardboard boxes instead of incubators. What's actually happening? Define for us the kind of setting in which health professionals are working in that allows for these events to happen.
So thank you, Thabo. So perhaps to start off with, very briefly, what a health system is meant to be, in which the healthcare providers, such as nurses, work. So just to say clearly, it's unacceptable in 2023 that we hear stories of newborn babies who should be in incubators who are being put in boxes. So clearly that's some improvisation on the part of healthcare providers, in this case nurses, and I do not want to condone it by any means. But certainly in the last few years, we've seen increasing focus being put on the concept of positive practice environments. So you might ask, well, what is a positive practice environment? And a positive practice environment is a healthcare setting which enables the provision of quality patient care and safe patient care, but also takes account of the well-being of health professionals or health workers. So it recognizes that in order for nurses and doctors and other health professionals to provide care, you need to ensure that they have the necessary equipment, that they have medication and consumables with which to do their job. And I just want to point out also that, of course, nurses are in the majority in the healthcare system, and so often they bear the brunt of the anger, certainly, which in many cases is justified, the anger of, patients, family members, and community members. But nurses are almost powerful if they don't have equipment, and if they don't have the tools of the trade, so to speak, with which to do their job. And I just want to highlight, finally, Thabo, that it's incredibly stressful on these nurses and other healthcare providers, because they know they're doing things that they're not supposed to be doing, that it's not safe to put a newborn baby who should be in an incubator and who should be perhaps receiving oxygen, and whose bodies should be kept warm by the incubators. It's incredibly stressful for them if they have to improvise by putting these newborn babies in boxes.
Yeah. Dr. Makua, let's bring you in here. I mean, why are healthcare practitioners forced to do this? There seems to be, at least from the patient's point of view, a gap between what the patients expect to be quality health care and what they are getting, particularly at our public institutions. Dr. Makua?
Yes, you are right, Abu. The issue could be just the disjuncture between what is expected and what is ideal. And sometimes it's the issue of communication. For an example, in this point in time, what we preach as what works best for newborns, it's what we call kangaroo mother care, which means babies should be in their mother's chest. But because the expectation is that when the baby is delivered, the baby must be put somewhere in the crib or somewhere in an incubator, that creates a problem. We actually know that putting a baby in an incubator has got less advantages than putting a baby in the mother's chest. But like you are saying, it could mostly be the expectations and the understanding. And I think the issue here is, how do we communicate? You can see if the baby is on the mother's chest, it gets the regulated warmth. But if you put the baby in an incubator, you run the risk of the temperature being either too high or too low, or whatever situation that could be. But the mother's temperature cannot be out of proportion.
Yeah.
So the issue is...
Dr. Makua, you're saying it's just purely because the health professionals felt they've got no other choice, because the expectation from the patient is that you will take the child and put them in an incubator. Is there no responsibility, I suppose, of the health professional themselves to say, well, in this particular instance, without an incubator, here is the best option, and therefore suggest that strongly, not only suggest that, actually advise in that as people who are in authority in their health space?
I think, Thabo, we also need to understand whether this baby was supposed to be in an incubator or was supposed to be in a crib. Let me indicate that those two gadgets don't serve the same purpose. Because if you have a normal newborn, which is what's the situation, yeah, you don't really need an incubator. You just need a space to put that baby.
Well, by indication this time around, there was a shortage of incubators. So those who are responsible say we needed more incubators than what we had available in terms of resource. So they would have made the decision that it's not a crib that is required, but an incubator.
Yes, that's what I'm saying. It depends on what the situation is. Because like I've indicated, I'm not going to discuss particular case situations because I'm not privy to the finer details. But what I'm saying is, under normal circumstances, whether the baby is sick, whether the baby is normal, a newborn baby, the safest place to put that baby is in the mother's chest. That's why we are all trying by all means to educate mothers to say kangaroo mother caring is the best. Even if the baby is very small, even if the baby is sick but is able to breathe spontaneously, the safest space is in the mother's chest. So what I'm saying is, in a situation where you would need an incubator, is in an extreme situation where, for an example, the mother's condition does not allow her to put the baby on the chest. And what we are saying is, definitely that's where the role of fathers come in, because we could also say if the mother is not well, the best is to get a substitute, because it doesn't say it has to be the mother's, it has to be a warm body. So it could be a grandmother, it could be a father. So if we have fathers also playing their role as father figures, they could also assist in their situations like this ones.
Yeah. Prof?
But the issue, it doesn't replace the fact that there could be some need where you would require an incubator in severe cases where the baby is sick. But what I'm saying is, because I'm not discussing particular case,
yes,
what I'm saying is, in circumstances where you have a dire situation, that would be the option.
Right. Prof, from the point of Dr. Makua to say these health professionals seemingly are armed with other techniques and other ways of responding to a lack of resource, and they are not using those particular options at this particular point in time. What could be the reason for that? I mean, could we just simply say, well, you're not using the resource, it's a lack of communication, it's a lack of being able to manage the situation the way that you would be expected to do as a professional? Here's a technique, get the fathers involved if the mother is otherwise disposed at that particular point.
I don't want to disagree with my esteemed colleague, but certainly, Thabo, there are different indications. My sense is that kangaroo care has been pioneered initially in South America, particularly for preterm infants that are very small, and there's very clear evidence that these babies, when you put them close to the mother's chest and with the mum, that they do very well, and their survival is actually better. But I think let's just separate the issues. Kangaroo care is very well known, and it's been practiced in South Africa certainly for the last 29 years of our democracy. Because post-democracy, and just to say, Thabo, that I'm very familiar with the health system. At one stage of my life, I was the head of the Gauteng Department of Health. So I'm certainly very familiar with the healthcare setting and with, what happens in clinics, in community health centers and hospitals. So certainly there are some indications for kangaroo mother care. I find it hard to believe that at this stage that nurses would not know about kangaroo mother care, and that a simple explanation would be that they're not aware or they haven't been trained in kangaroo mother care because it's been widely promoted in South Africa and in our public health care system, because the benefits are very clear. The sick babies, in some instances, a baby is sick and maybe the mother is also not well, and in those instances you need incubators. So one scenario is that in this case, these babies needed, that were put in the boxes, actually needed an incubator. And so then we have to acknowledge, in that instance, the health system has failed both the nurses as well as these babies and their parents.
So let's look at here. Let me come in. Sorry, there, Prof. We have 56 babies delivered in the ward, but only 16 incubators and 31 cribs were available at that time. I'm looking at that and I'm saying, well, once the 31 cribs have been used up, how difficult would it be then for the health professional to go to the mother and say, well, 31 cribs have been used up. Your child does not necessarily need an incubator, but you could use the kangaroo mother technique in that instance. Marrying that to what Dr. Makua is saying was there's also an expectation. Will the patients and the mothers be willing to adopt that particular technique in an instance where a resource like a crib is not available?
Yes, sure. And in that instance, perhaps the action of the nurse or the nurses point to a kind of a need to revitalize, those messages around kangaroo mother care, as well as those messages about how best do we actually, in the face of resource constraints, what would be other options that would have been open. So I'm not excluding that option. We now, to some extent, the three of us are having a theoretical discussion, and we need to find out what are the details in that particular hospital, almost do a root cause analysis, and then actually look at, was it a case that the nurses didn't actually, yes, they work on resource constraints, but that the nurses were not aware of the option of kangaroo mother care, and then that would point to the need for, for in-service training, and actually a reminder of the benefits of kangaroo mother care. That's one option, or one solution. The second one would be obviously to deal with the issues around the resource constraints, and whether there's a need to find additional cribs and or incubators. And then, as I said already, clearly a revitalization of the kind of messages around kangaroo mother care and the benefits of that care.
Dr. Manala, let me come back to you. I mean, is there a sense also from the National Department of Health that the lack of resource could actually hamper health professionals from actually doing things properly as according to prescribed procedure? And that in itself certainly puts a limitation on them being able to carry out the work the way that they should.
Yes, I think that is not a fact to dispute. We are aware. Any person, you can imagine if right now you were trying to take an interview and my phone is not working, what could be the worst case scenario? It happens. So we know tools of trade are basic. But we also need to acknowledge the fact that circumstances are different, circumstances are dictate different ways. Let me put out the slight difference in the scenario. When you deal with a newborn, time is of essence. We have what you call a golden minute in life. And that minute, that first minute of life determines what quality of life will the baby have for the rest of his or her life. And sometimes when you think of the general challenges that you face as a healthcare worker, the resources, the management, the protocols and all that, but you also reflect as a clinician to say, I have a minute. That's why we call it golden. I have a minute to really make a difference in the life of this. Then you start prioritizing to say, is it proper for me to pick up a phone and call a next hospital somewhere to borrow an extra crib or an incubator, or is it critical for me to make sure that in this minute I keep this baby warm and make sure that the baby starts suckling and have the first breast so that the mother can have a successful breastfeeding. So we really need to balance the situation. When we discuss issues like this, it's not only about resources, it's also about dealing with the life of the baby that is at stake here. So you have that golden minute. If you miss the golden minute, then you also have the next time, and the next time that you have is only 5 minutes. So you can imagine that you are having babies delivered one after the other. Each one of them requires a golden minute or a golden 5 minutes. Yeah. And you have to act fast and make sure that you don't divert priority and focus on picking up a phone and calling somebody instead of keeping the baby warm. I think that's where
beautiful moments, Dr. Makua. Beautiful moment, golden minute, golden 5 minutes. That would probably be something that a clinician would have the ability to recall in a space where they are not under stress. Professor is saying already the clinicians, the health professionals themselves are really not in a healthy space of mind because of the stress that they are working in, and a stress that really could be eliminated by better tools of the trade and what she calls a positive practice environment. How difficult is it to create that positive practice environment, and what are the difficulties of creating that?
Creating a positive environment is a continuous process, and it doesn't happen every day. And in any work environment, there are days where things are easier, but there are days when things are bad. And you can imagine that delivery is a spontaneous process. You can have the whole night without a delivery, and then you have the other day where you have 6 deliveries or even more deliveries. And obviously the level of tension will actually tally with the workload, the circumstances, and the skills mix that you have. So it's a continuous process. It's not something that you'd say you do in the morning or do it in the afternoon. A continuous positive environment, it's a process. And when you're asking me how difficult or how easy is it, it's really based on the context and the circumstances at that given time. I think what is important is, after the scenario, reflecting, debriefing, supporting, doing a root cause analysis like Prof indicated, that's what would make a difference. But the moment can be different and can be handled differently. But the reflection afterwards, even when you work in the maternity ward, you can even get the worst case scenario. You can have a situation where it's a matter of life and death. You can have a situation where the mother's life is at stake. Sometimes you do your best and you win. Sometimes you do your best, but you still lose. What is critical is positive environment would involve reflecting, supporting, and continuously making sure that we don't have the same incident happening in the similar way. So Prof has indicated some couple of issues. Continuous communication with our patients, revisiting the expectations from both sides. Because sometimes, yes, it's a real, genuine, abnormal environment, but sometimes it's an issue of expectations from either side. So we over-expecting from the healthcare system and then creating more demand where we could actually be talking a language of self-care, or core management of babies. So when people get to the hospital, there's certain expectations that they still need to fulfill. It cannot be that they should expect 100%. They still have to do a minimum like just feeding their own babies. So that expectation can go a long way. I think what we should be having as a next session for this on this show is, how do we bridge the gap between expectations from the providers and the people who receive the care? And that in itself can go a long way in managing some of the shortages of resources that we have.
Yeah,
because
what does this tell you? What does this tell you about? What does this tell you about expectation? People took to Facebook voicing their anger. This is what people are saying some people are so heartless. What kind of people are these that put babies in boxes, right? Another one says, what a disgrace. The whole provincial hospital, the capital town, Nogal, ANC finished this country. I mean, this is the kind of reaction. People are finding that kind of behavior disgraceful. And are you putting that down to just mere an expectation? I mean, is it too much to ask for people to expect at least that kind of health services being delivered for them?
I think it's a couple of issues. I think our healthcare system, we still need to have a long way. I can imagine the concept of using a card box. It's been researched formally and it's been used in first world countries. But the question is, what type of a box? But because it's been told a card box, then everyone's thinking of just something that is not clean, that is dirty, that cannot be. But it's a concept. That's what I'm saying. We still have a long way in working together as the users of the healthcare service. Because someone would not even try to understand, to say, what were the circumstances? What would be the worst case scenario? Yeah. If it was not the box, what would it be? Would it be exposing a baby to hypothermia? If a child is exposed to hypothermia, then you're destroying that quality of life of that baby rather than putting that baby in a box. Context matters, communication matters, and expectations should be contextualized. That can take us a long way as a community.
Prof, expectations should be contextualized. That's one area you can touch on as we wrap up, but also the positive practice environment is almost a moving target. It's work in progress. Sometimes you achieve it, sometimes you don't.
So Thabo, I think we also have to remember that we have a raft of legislation in South Africa which actually ensure our citizens of their rights. You know, both as their rights are clearly outlined. We have a rights-based constitution. The National Health Act, a key part of the National Health Act actually contains what's called a Patients' Rights Charter. We have a a kind of regulatory entity called the Office of Health Standards Compliance, and their entire job is actually focused on ensuring that when people use health facilities, especially public health facilities, that they're entitled to a certain standard of care. While I agree with Dr. Manala that clearly, there's need for better communication between patients and healthcare providers, but at its core, Thabo, I think it's the responsibility of management. That's what their job entails. They're supposed to ensure that, they manage the hospital or the facility in such a way that in the first instance, you begin to create the environment for quality patient care and especially safe patient care. So I do not think it's unrealistic for somebody to expect that they would be treated in a humane manner, and that they would be treated, that they would receive safe care, and that certainly there would be explanation both of their condition as well as the care that they can expect, to get. I think, yes, we need to make sure that there's continuing professional development of our health professionals, but we need to create as kind of the healthcare authorities and as managers, we need to make sure that we create an environment that provides safe and quality patient care, and that actually takes care of the well-being of staff. Because there's also the potential for managers to actually engage with healthcare providers and find out whether there's ways and means of providing care that people, expect. So I don't think it's a problem of expectations. I rather think the onus must be on managers and healthcare authorities to actually say, how do we achieve that progressive realization of access to good quality health care that our Constitution promises us?
Prof, appreciate your time. Let's leave it there for this evening. And Dr. Manala, thank you very much for coming on. That's Professor Laetitia Rispel from the Wits School of Public Health and Dr. Manala Makua from the National Department of Health.